Today on the floor to talk about an epidemic that has gripped my state of Ohio and affected every single state in this body and every community we represent. And that's the issue of prescription drug, heroin, and now fentanyl and other synthetic heroin addiction. This epidemic is affecting our communities in fundamental ways. It's breaking families apart. It's causing crime. In fact, in my home state of Ohio, as I talk to law enforcement officials in every county, they tell me it's the top reason for crime and the growth in crime. It's certainly affecting our first responders. When I go to a firehouse now and talk to the firefighters there about what they do with most of their time, they tell me they do a lot more heroin runs than they do fire runs. And thank God, because they're out there saving lives every single day. They now carry Narcan with them, which is a form of naloxone, which is a miracle drug that reduces the dangers here because it reverses the effects of an overdose. They've, by the way, applied Narcan 19,000 times in the last year in Ohio. So this is something that is out there in all of our communities. Sometimes there's a huge spike in these overdoses, and we had that this week, sadly, in Columbus, Ohio, where in the space of just 24 hours, we had 27 overdoses. We're working with the county coroner's office and with the health department in the city of Columbus to try to help them to determine what the cause of this spike in overdoses was, but it appears to be another case where there is a particularly dangerous batch of heroin, probably has something to do with these synthetic heroins that are coming in to our state and our country. Fentanyl, carfentanil, U4, a few flakes of carfentanil ingested can kill you. This is really dangerous stuff. I wish I could say it's getting better, but I fear that it's only getting worse. I've been on this floor talking about this issue every single week since February. During that time period, we passed by a vote of 92-2 legislation to help address this issue. 92-2 is a rare vote in this place because Republicans and Democrats came together on this issue. We were able to pass something that will help. We spent 3.5 years working on it. My colleague Sheldon Whitehouse from Rhode Island and I are the co-authors of it. Others were very involved to help ensure that we can get better prevention and education efforts out there, do more in terms of treatment for people who are addicted and need to get help, longer-term recovery, which we believe is essential to successful treatment because all the facts indicate that unless you have that longer-term recovery, the relapse rate is very high. We also help our police officers and our firefighters and other first responders by saying, let's get them the Narcan that they need and the training they need to be able to save those lives. It also helps very specifically with our veterans, with pregnant women who are addicted, with these babies who are born with dependency. Some very specific programs are going to help to turn the tide. Overall, I would say the legislation is important because for the first time ever, not only is Congress supporting recovery, as we talked about, but also we are finally addressing this issue as I think it needs to be addressed, as a public health issue, saying this is not a question of someone making a bad moral choice as much as it is a disease. And it needs to be treated like a disease. And until addiction is treated as a disease, I think it's going to be very difficult for us to turn this tide and begin to save these lives. In my home state, it's been the top cause of accidental death, surpassing car accidents probably since 2007. Sadly, that is now the case in many states around the country, and nationally, we believe it's the #1 cause of accidental death. Think about that. It's a situation that affects every state and our entire country, so that in the legislation that was passed yesterday called the Continuing Resolution, which is basically just a bill to continue the funding of government through December, it's a short-term spending bill, we were able to have included in there $37 million to help implement this legislation, the Comprehensive Addiction and Recovery Act. I'm very proud of that, and I'm very pleased that this United States Senate and the House was willing to go along with that. I know it's unusual because typically in a continuing resolution, you simply fund the previous year's funding and there are no new programs, no new starts. And frankly, the administration did not recommend a new start in this instance, although they did recommend an anomaly or an addition to the CR in 27 other areas. So we had to rely on the members here in the House and the Senate to do the right thing and to make an exception and to include this funding. And I want to thank my colleagues for doing that. I think it's critical that we begin to fully fund this Comprehensive Addiction and Recovery Act, otherwise known as CARA, and do it now, and not wait until the regular appropriations process in December. So that $37 million will help us stand up some programs. Four in particular I want to mention this morning. One is the community-based coalition prevention grants. Second is the grants for access to overdose treatment. Third is the recovery grants. And fourth is the state incentive grants for a comprehensive response to this opioid issue. So in other words, we're dealing with prevention and education, treatment, recovery, helping to get the states more engaged and involved in this issue to help them so the federal government can be a better partner. On the prevention side, what it does is start to tell people what's going on. We're doing that here today on the floor, but specifically to let people know what this connection is between prescription drugs and prescription drug overprescribing and abuse and heroin and fentanyl. The reason I think this is very important is that probably 4 out of 5 heroin addicts in Ohio started with prescription drugs. And many people don't know that. And when they're prescribed a prescription drug for pain relief, sometimes they don't realize the potential here for an addiction. To the young people who are listening today, you need to know this. You need to understand this. Everybody does. But this is something that if, again, we are going to turn the tide, we have to change the way we deal with it to ensure that people are getting the education that they need to avoid getting into the funnel of addiction in the first place. This program called CARA, again, also increases the availability of this naloxone or Narcan, which is very important. It has long-term recovery grants, including grants for recovery colleges, recovery universities, in other words, programs within colleges and universities to help on recovery, because unfortunately, many of our students, we are finding, need these recovery programs as they are trying to work through their addiction. It also supports recovery high schools and increases eligibility for alternatives to incarceration, so drug courts, veterans courts, instead of putting people in jail for using these drugs, to say, let's do a diversion here, to say if you stay sober and clean, you will stay out of jail, we'll get you into treatment. These programs, as I've seen around our state, can work to be able to get people back on their feet. These are critical changes, and the experts who helped us write this legislation over the last 3.5 years, who came here to Washington, where we held 4 different conferences on this issue, where we brought in the best minds, the best practices, they tell us they believe this legislation will make a difference in our communities day to day. Now, of course, it's up to the administration to actually implement this aggressively. Congress has done its work to pass these new programs, to pass this legislation. Now it shifts over to the executive branch for administering it. There is no excuse that the funding is not there, because we were able to provide this funding. It's an exception to a normal CR, but we got the funding in, the $37 million, to begin to get these programs up and running, again, so we can begin to turn the tide of this addiction epidemic. There are some aspects of the legislation that are already working that don't require a new program or setting up a new program. For instance, nurse practitioners, physician's assistants are now permitted to be involved in administering Suboxone at treatment clinics around the country. We should get that up and going now. That shouldn't require a lot of time and effort and new programs. Earlier this week, I had the opportunity to be at a fire station in Norwood, Ohio. This is a community of about 19,000 people that had 56 overdoses since June 1st. So one small town in Ohio, 56 overdoses just this summer. I met with law enforcement, I met with firefighters, I met with other first responders. I got to meet with a treatment specialist who they had brought in to help work with them. They're doing some really interesting intervention work with families. They showed me a video of a young man who was overdosing. They showed me the video of police officers and then firefighters administering Narcan not once, not twice, but 3 times. They showed how he was brought back to life. It was tough to watch, but firefighters and other first responders, police officers, see that every single day. Every 3 hours, somebody dies in Ohio of an overdose. But every 3 hours, many more are saved by the administering of naloxone, Narcan, to bring them back to life. The key is, as they're doing in Norwood, Ohio, then to intervene with that person and with the family and with the friends and to get that person into treatment so they're not administering Narcan again the next week or sometimes even the next day. Over the last 4 years, the number of heroin overdoses has tripled. Let me repeat that. In the last 4 years, the number of heroin overdoses has tripled. And sadly, there's reason to believe that this trend is continuing. Even though our first responders saved the vast majority of those who overdose, in Ohio, we are losing more lives every day. We already have more drug overdoses and more drug overdose deaths this year at the end of September than we had all of last year. Of course, the numbers don't really tell the story. The story is about people. It's about dreams that have been shattered. It's about lives that have been cut short, often lives that are promising and young. It's about people like the 25-year-old student who was found dead of a heroin overdose in a bathroom stall at Columbus State University last week, 25 years old, his whole life ahead of him. It's about people like the Hess family of Crestline, Ohio. Their son Jason was a college student, a talented musician, a gifted athlete. One of his classmates got him to try heroin. He said, just try it. Almost immediately, the drugs became everything in Jason's life. As Jason's dad has said, he liked his dealer more than he liked me. I've met with several hundred addicts or recovering addicts in Ohio over the last few years. Many of them tell me the same thing, which is the drugs do become everything. So they become everything ahead of friends and family and work. Jason struggled with his addiction for 15 years. He was in and out of jail a lot, in and out of hospitals. In the past 2 months, his dad saved his life twice with naloxone because as family members, they're now permitted to get Narcan over the counter. A few weeks ago, Jason died of an overdose, 35 years old. When his mother heard the death notice a few hours later, she was informed about it. She went to a cemetery with a bottle of Valium, and she committed suicide. It was her 60th birthday. In a note she left behind, she said this, thanks, heroin, period. Another victim, period. That was the note that she left for all of us. With this crisis getting worse and taking such a toll in Ohio again, we've got to get this legislation implemented as soon as possible, and we have to continue to fight, not just for more funding, but for better ideas and ways to address this problem at every level and in a comprehensive way. We need this support for safe disposal sites for prescription drugs. That's part of the legislation. So that when you go to the drugstore, you're at the drug counter, you're at the pharmacy, and you're getting your medication, you also have an opportunity right next to you to dispose of some of the medication you may not have used. What the experts tell us, and I've been to these drop-off sites. I was at one recently at Walgreens in Toledo where they're implementing a program to provide these sites and to provide safe disposal of these drugs so they don't get in the wrong hands. They tell me that in most families in America, there are drugs available that can be dangerous. Many times it's prescription drugs that are painkillers, that are very addictive. In Marion, Ohio, recently an 18-month-old girl was able to get into her parents' Percocet, 18 months old. She overdosed. We need these disposal sites to help protect kids like her. We need CARE's prevention efforts, such as its national awareness campaign, but making this link I talked about between prescription drugs and heroin. People need to understand this. Kelly Clixby of Marion, Ohio, needed that information. I met her back earlier this year when I visited the Crawford Marion Board of Alcohol, Drug Addiction, and Mental Health Services, where they're working hard every day to fight back against this epidemic. When I visited there, the director, Judy Demo-Hodgkins, told me that they are so overwhelmed with patients that, and I quote, most of the time I feel like I'm drowning. They are overwhelmed, but they're doing a great job. And Kelly's an example. She was prescribed painkillers. She was addicted, became addicted to those painkillers, and as in the case of many people, when those pills became too addictive and too expensive, when she couldn't afford them, she turned to heroin. Heroin's less expensive and more available, actually, in many cases. Within a year, she'd lost her job, her house, her car, custody of her 5 kids. Over the next decade, she and her husband, Randy, got a divorce, She was arrested 4 different times for shoplifting. She went to jail 19 times. She overdosed. Paramedics saved her life with naloxone, this Narcan we talked about. When she was in the grip of this addiction, Kelly didn't even want to get out of bed in the morning. She felt like she couldn't even get started on her day. She felt a constant sense of despair. Kelly's life turned around when her best friend, Christina, died of a heroin overdose. She realized at that point that she needed to get treatment. 9 months to the day after paramedics saved her life, Kelly got clean. Now, with the help of medication, in her case, Vivitrol, which is medication that actually blocks the craving for the opioid, and it's worked very well in many cases in Ohio, including in our drug courts. But with the help of Vivitrol and the compassionate people at the Marion Area Counseling Center, Kelly's now been sober for 1.5 years. She's back together with her husband, Randy. She's back together with her kids, with her family. She's now a grandmother. She's leading a 12-step program to help others. So she's beating this because she got treatment. CARA, Comprehensive Addiction Recovery Act, will help get more people into treatment so we can have more success stories like Kelly's. As I said, we need to raise awareness about how easy it is to become addicted to these opioids. I believe that will also help us to be able to push aside the stigma that's so often associated with addiction. That's one reason people don't come forward and get treatment. Kelly said that the stigma of addiction kept her from getting help when she needed it. She said, you feel horrible for stealing because you need to get high. Then you get high and you feel horrible for getting high. Then you have to steal again. I felt guilty because I used, and I used because I felt guilty. And the stigma kept me from coming forward. Think about Tara Guest. Tara Guest is from Lorain, Ohio. She was a nurse's aide at a nursing home. She'd been a good student and a talented artist. One day she was on her way to work and hurrying down some stairs in her apartment building, and she slipped and she fell. She broke her ankle. When she went to the doctor prescribed her Percocets and then OxyContin. She became addicted. When the prescriptions expired, like so many, she turned to heroin. Her mom, Lori, who's a strong advocate on this issue and heads up the Lorain Community Task Force, by the way, found out about Tara's addiction when Tara was evicted from her apartment and started living out of her car. Lori, her mom, felt what so many moms and dads have experienced in Ohio and across the country. She said that when her kids were young, we never discussed heroin. I never thought it'd be part of our lives. You don't think it's going to be your child. You don't think it's going to be in your family. And when it is, the stigma is so great, it makes you feel ashamed. And you don't want to talk about it. Her daughter, Tara, fought this addiction for 2 years. At just 24 years old, she died of an overdose of heroin that was laced with fentanyl. Fentanyl is this synthetic heroin that is creeping into our communities, this poison that's coming into our country from other countries, particularly China and India, coming here by the mail system. For Tara, it started with a broken ankle. It could happen to anybody. That's why we need this prevention effort to warn people about the dangers and to help end the stigma, to keep people from hiding it, to get them to come forward. For all these reasons, the prevention, the treatment, the recovery, and ending the stigma, the people we represent need this legislation to be enacted, but also to be implemented as soon as possible. In order to help as many people as we can, we've got to get the funding, the CR working, and we've got to continue to fight for funding. Madam President, we've talked about a lot of tough stories today, and unfortunately, the grip of this addiction is so great that there are a lot of heartbreaking stories, and it's getting worse, not better. But there's also hope, and there's hope that I see every week when I'm back home in Ohio. Recently met Sheila Humphrey, whose child succumbed to a heroin addiction and an overdose and death. She's now started her own organization with other moms and family members, and they're having great success, again, in intervening in these families and explaining the reason to get treatment and get into recovery. She gave me this bracelet. It talks about the Rally for Recovery in 2016. We had one in Ohio last weekend. I was able to attend. At that rally with the Ohio Citizens Advocates for Addiction Recovery, I got to meet so many people who were in recovery. They came forward to talk to me about their stories. They came forward to talk about what they're doing to help others. They talked to me about the need for us to have more treatment, better recovery programs. I met someone who has not only beaten his addiction, but is now an addiction counselor in Dayton, Ohio. His name is Gary. Gary Cannella is helping others to be able to get their lives back on track, and he's incredibly persuasive because he's got a story to tell. He told me, Senator, there is hope. Don't give up. He's telling me don't give up. I'm telling my colleagues, people expect us not to give up. They're not giving up. This guy, Gary, is a recovering addict. He's not giving up, and he's asking us to ensure that we do everything we can to help, to be a better partner with state government and local government and with the nonprofits who are out there in the trenches every day doing this work, with the folks like Gary who are looking for our help. Kara will give more people more hope. So on behalf of all of those I talked about today, those whose lives were cut short, their family members, on behalf of our communities, let's continue this fight. Let's ensure that we do, in fact, get Kara implemented quickly. Let's ensure that we do continue to push, not just to provide funding, but new ideas and better ideas. There's new legislation we've just introduced in the last couple of weeks called the STOP Act that stops this synthetic heroin, the fentanyl and carfentanil and U4 from coming into our country from other countries by requiring that packages include information about where the package is from, what's in it, where it's going. That's not required now in the Postal Service. It is required by private carriers, so these traffickers are using the postal system, including the U.S. postal system, to move this deadly poison into our communities. We need to stop that. So there is more we can and should do. It's our responsibility to do that. And Madam President, as we break for these elections, as the lame duck period in December comes upon us, after that, let's continue to work to ensure that we are able to turn this tide and bring back more hope. I yield back my time.